Understanding the arguments for universal health care. Now, the funny thing is that we have to give these titles, submit these titles like 3, 4, 5 months in advance of the actual conference. So what ends up happening is you generally know what you want to talk about, but then as you get closer to the conference, your thinking develops, my thinking develops, and you really figure out what you want to say. So I'm going to take the liberty of updating my title. I hope you don't mind. The new title of my talk is Universal Healthcare, Myths versus Reality, because that's really what I want to talk about today. There's definitely a disconnect between what proponents of universal healthcare say universal healthcare is and what's really going on in the countries that have it. There's a disconnect there, and we need to be aware of it. And we need to be aware of it, first and foremost, for a very, very practical reason. If you live in the United States, I know we have some international people at the conference, but if you live in the United States, that's what's being sold in America today. That's what the left is trying to push us towards, universal health care. You might be thinking, don't we already have universal health care? Well, no, we don't already have universal health care. We've taken significant steps towards it. Obamacare was the latest step towards it, but the United States is still recognized as a country that does not have universal health care. And people want us to go there. People want us to go and embrace universal health care. And one of the things that they say, one of the arguments that are made, is that, well, look at the countries that do have universal health care. Things are great there. Things are great in countries with universal health care. So that's one piece of evidence that we should be embracing universal health care. So that's why we need to be clear on this, particularly in America. What is being said about medical care in other countries? What is the state of care in those countries? Does it really live up to what proponents are saying? So that's what I want to do today. Are we headed towards Shangri-La? And spoiler alert, my takeaway from this, I hope you get, is no, we're not. There's a lot of really troubling and disturbing things going on in countries with universal health care, and I do not think that that is a model for how we should be proceeding. So we'll talk about that, and I'll give examples of what is going on in these countries, and then I'll talk about why there's the disconnect, why proponents of universal health care say what they do, why they think these countries have good health care, and why they really don't. And where's the disconnect? Are they just making it up? Are they just lying? What's going on? Sound okay? Right? Okay. Good. So let's start with some definitions. One definition, really, just so we're clear on what we're talking about. What the heck is universal health care? What do people mean when they say universal health care? So what they generally mean, what they usually mean, is a system in which the government guarantees everybody access to a certain level of medical care. Now, they might put it a little differently, different people might put it differently, but that's the general idea. That if you live in a country with universal health care, and you get diagnosed with diabetes, or cancer, or you break your leg, or you need heart surgery, the idea is that the government has set things up so that you don't have to worry about the cost of any of those services. That you don't have to worry that, hey, I might not be able to get this service because I can't afford it. You're not supposed to have to worry about that kind of thing. The government is guaranteeing that you will have access to these things regardless of whether you can pay for them. And the countries that have universal health care, that are said to have achieved universal health care. So the United States is not one of those countries. But all of Europe is said to have achieved universal health care. Eastern Asian countries are said to have achieved universal health care. Japan, Taiwan, South Korea, all have various forms of universal health care. Canada has universal health care. United Kingdom, you're familiar with, most likely, has universal health care, socialized medicine. And it's important to point out, these countries achieve universal health care in different ways. So we tend to think of the United Kingdom, where it's total socialized medicine, where the government has taken over the financing of medical care and the production of medical care. So it runs the hospitals, doctors work for the NHS, that kind of thing. But that's not the only way you can achieve universal health care, and proponents are very open about this, that there's different ways you can do this. In Canada, the government controls the financing. It's single payer, but it leaves the production to the government doesn't control that directly. And then you have countries, in a lot of countries in Europe, like France, like Germany, that are often idealized, and these countries, nothing is outright socialized. The government doesn't own the doctors don't work for the government, the hospitals aren't run by the government, they have insurance companies, and these countries are achieving universal health care by really exerting a lot of regulation, a lot of control over private businesses, private insurance companies, doctors, hospitals, drug companies, et cetera. And so that's how they're achieving it. So there's all sorts of different ways to get there. But all of these countries, most of the world, most of the developed world, the industrialized world, has achieved universal health care. So what do proponents say? What do they point to when they say, look, things are really great in countries with universal health care? Well, they say a lot of things. I want to focus on two of the things that they say that I think are the most common, the common arguments that come up. So they'll say, look, this is a very common graph. Oh, can we go to the, okay, thank you. This is a very common thing that's said. You might have heard this, that countries with universal health care spend a lot less on health care. If you look at it in terms of how much health care spending they do per GDP, as a percentage of GDP, they all spend a lot less. So here, I don't know if you can read that, but there's France, there's Germany, there's Switzerland, there's Canada, let's see what else, the United Kingdom, Sweden, Italy, Australia. And they all tend to spend a lot less than the United States on healthcare. And proponents say, look, this is a good thing. Like, we're spending around 17, 18% of our GDP on healthcare in the United States. These other countries clearly have figured something out. They're spending less. That's a great thing. Don't we want cheaper care? Don't we want to spend less on care? And it's not that they say, look, you're spending less on care and you're getting worse care, because that wouldn't, nobody in America would go for that. No, if you actually rank these countries, then there's lots of studies, and a lot of people do this, and they have very comprehensive studies, and they're very complex, and they factor in a lot of things, and they come up with these rankings for healthcare systems. And countries with universal healthcare always come out on top. So there was a very famous study done by the World Health Organization in 2000. And there have been many studies done since then, but this one really was very big and very important, and people still refer to it today. And they ranked, I think, 190 countries, and very complex study, huge report. And they came out and said, they ranked all the different countries, and they said, France, if you can believe it, France is actually the best healthcare system in the world, #1. And it's followed by things like Italy and Spain, and Austria, and Norway, and Portugal, and Canada, and the United Kingdom, and Germany, and Japan. And the United States, which does not have universal health care, ranked number 37. And so proponents of universal health care say, well, look, they're spending less on health care. It's cheaper there. They're getting really good quality, as good as the United States, if not better. And everybody's covered. Everybody has this guarantee that you don't have to pay for, you don't have to worry about paying for it, the government's got you covered. That's what's being said. So now let's look at what's really going on. What I see is really going on. And then, like I said at the end, we'll try to match up the two stories, in a sense, what I'm going to say and what the proponents are saying and how they connect to each other and what's going on. So I don't think that you can really talk about what's going on in other countries with the state of their medical care. I don't think you can talk about that without keeping the big picture in mind. And the big picture in mind is actually, I think, not very hard to see. You have to start digging in just a little bit and reading about the state of these medical systems, these universal healthcare systems, to see that the main thing going on, And it's true in the United States as well. And so you'll have heard this in the United States as well. But the main thing that they're all very, very much concerned about is cost. Cost is a major issue. All of these countries are deeply in the red when it comes to their healthcare systems. Deeply in the red means that what they bring in taxes for these programs does not even close to add up to matching what they're actually spending. There's a whole lot of spending going on and not enough money coming in. And so they're all in the red, and this is a big problem for them. And they recognize, the governments recognize, yeah, we're in the red, we're running deficits every single year. You look at a country like France, they're running billions of euros in deficits every single year. Germany has $7 billion deficits. Japan has a growing deficit nightmare in the country more broadly, and healthcare is a big part of that. Taiwan, which recently socialized in the grand scheme of things, it's a very new universal healthcare system. It's only 20 years old, and it has run deficits almost every single year. But that's what's going on. That's the perspective, if you start looking at it, that all of the people who are in charge of these systems, running these systems, making decisions about these systems, that's the first thing that's on their mind. And it should be on their mind because they're deeply in the red. So everything that these systems are doing, everything that's happening in these systems, is happening from the perspective of cost control. Everything that they're doing to keep costs under control, to limit their costs. Because there's two ways you can do cost control, right? You can either cut spending, or you can raise taxes. And raising taxes, and we'll talk about that, but that doesn't tend to be popular. So a big focus for all of these countries, and it's been this way for decades, because this is a problem they've dealt with for decades. And in the United States as well, this is a problem you'll always hear. We have a cost problem. That's why people are talking about healthcare. It's always an issue in the presidential election, because healthcare costs, the cost of Medicare, which is universal healthcare, is enormous, and it's very much a major contributor to deficits and the long-term debt in our country. So that's the lens through which I want to look at what's going on in these countries, because that's the lens I believe that the people running these systems are looking at it through. How are we going to keep costs low? How are we going to cut spending, limit spending? And I think this will show the state of the medical care. It'll give us a good idea. So I'm going to break this up into 3 parts. What are these countries doing to keep their costs low, to limit their spending? So this is something, if you've thought about this, or you've read about this issue, or if you've gone to other countries and you've experienced medical care there, a lot of people tell me, everything in Europe, all the medical services in Europe are just cheaper than they are in the United States. The cost of an MRI, the cost of a hip replacement, the cost of the same drug, Lipitor in the United States versus Lipitor in New Zealand. Everything there is just cheaper. The prices are just lower. It's true, they are. Everything there is cheaper. The price is lower. But it's lower not because those countries are particularly efficient in production that they can really bring down their costs or anything, but it's cheaper because the government keeps the prices low. A major, probably the number one way that the government keeps its costs low, keeps its spending down, is by controlling all the prices. Prices of every drug, every medical treatment, prices of what it pays doctors and hospitals and all healthcare professionals. It's all kept artificially low, below market price, by the government. Now, you might think, in the moment, right, that sounds good. Well, I don't have to pay more for the same thing. If I can get a drug cheaper in New Zealand, it seems crazy. Why? I mean, that's nice. Thank you, government. But price controls, right, they don't come without consequence. The massive price controls that are in all of these countries, they do not come without consequence. So let's talk about this a little bit. I want to take the example of doctors. Doctors in countries with universal health care do not set their own prices for their services. That is something that the government sets, and you are not allowed to charge more. So if the government says, for example, in France, that you get paid around 30, 35, 40 bucks in US dollars for every visit that a patient gives you. That's what you get paid. You get 30 bucks or 40 bucks, whatever it is. That's it, that you cannot charge more than that. Well, what are some impacts of that? Impacts that have to be the case. Well, if you tell a doctor, well, this is as much as you can charge for your services, right? The doctor still got all the costs that he has to pay to keep in business, to pay himself, to pay his staff if he has any staff, all the costs of staying in business. If you tell him, okay, you can only charge 30 bucks, that's all you're getting, it means that the doctor can only afford to give you so much of his time. He can only afford to give you so much of his time. And this happens in the United States too. There's a real sense in which doctors are rushing patients out the door. And it's not because, well, they don't want to see you, but they have to see a lot of people because they're not getting paid very much for each of them. So they have to make it up in volume. So this happens here, this happens everywhere. In Japan, Japan is notorious. It has one of the lowest payment rates for doctors. So in Japan, 2/3 of the patients see their doctor for less than 10 minutes. 1 out of 5 see their doctor for less than 3 minutes. Because that's all the doctors can afford to do. They're not making any money. And so they have to make it up in volume, which means they can't give any one person a lot of time, which isn't great if you're the patient and you need some more time. Price controls also mean that you might not be able to hire the administrative help you need, right? You might need someone to do billing, and you might need people to help you out and keep the office going, and you might not have enough money for that. And that's not uncommon. In France, for example, most doctors cannot afford to hire any administrative help. They're doing everything by themselves. So there's no division of labor. And I have this quote up here, if you can go back to the slide, and this was a doctor, and she was actually a Canadian doctor, and she went to Paris, and she was commenting on what she saw in Paris, and then she's practicing now, and she's practicing France, but she's out of the system. She's not part of the government system anymore. But she said, they do everything themselves, referring to doctors. They do everything themselves, from opening the door to taking their own calls, to opening the door to patients, to booking their own appointments, and taking payment. I have no idea when they have time to do actual medicine, because they're doing everything else. And this is a direct result of the fact that they are not able to charge appropriately for their services. But this is what the government does to keep the cost low. Price controls, controlling the price of a doctor or controlling the price of what you pay a hospital, also means that they are less able to get the latest technology, to update their technology, to have the latest equipment. So in Japan, for example, which is notorious for really shafting doctors and hospitals, and that is a major way by which they keep their costs low. You have new technology, new equipment simply just missing from a lot of hospitals because there's no way that the government, that these hospitals can actually afford to get the newest equipment. Price controls on doctors also means that they have less time to be able to afford to not practice and take some time away and do their continuing medical education, to keep up to date on the latest research and what's going on in their field and what are the papers coming out and what are the new treatments. All that requires time, but time requires that the doctor can actually afford to do this, which means he has to be able to set his prices in a way that he can set aside time for that, that he can afford time to think about how to become a better doctor. And that's not the case. There's very little time the doctors can afford to do this, given what they're paid. And price controls on doctors also means what? That they tend to then go to those fields of medicine where there's less government control, where they have more freedom to do things that they want to do, to make their experience with their job, which they're doing every single day, a better one, a more comfortable one. So if you take a country like Taiwan, which I said is a very new universal healthcare system, it's only 2 decades old, it turned 20 years old this year. Taiwan is one of the Asian tigers, and so as soon as they had a little bit of wealth, of course they socialized their medicine. But even there, just 20 years later, doctors are increasingly leaving fields like OBGYN, surgery, pediatrics, ER medicine, and going into the freer areas where they have more control and more freedom, like dermatology, ophthalmology, cosmetic surgery. And it's a real problem for them, because if you need those other services, if you need an OBGYN, and they're all going, or more and more of them are going to freer fields, that's a problem for you definitely as a patient, because it means you have to wait. And Spain is also notorious for this. So price controls on doctors cause a lot of problems for patients, and it causes a lot of problems for doctors. These countries also limit spending by controlling the price of drugs and treatments. And here, a lot of the same effects apply that I talked about with doctors, because price controls, they have universal effects that people understand. But here I want to talk about the effect of innovation, what price controls do to innovation in these countries. Because where does innovation come from? Where does the next great drug or the next great treatment, the next life-advancing, life-saving treatment come from? Right? It comes from a producer's ability to generate surplus, to generate a profit, that profit that they can then afford to then put aside some of it into future R&D, into developing the next great drug. That's how innovation occurs. And the more you control prices and the more you control profits, it means the less that these producers can put into creating the next great thing. So these countries, in one way you can put it, you can think about it, is they keep costs low, they keep their costs down by not paying the price that innovation demands. They're not paying the price innovation demands. But they can mask this fact. They can mask this fact because a lot of these countries have really great state-of-the-art care. They have really great state-of-the-art care. How do they have that? Well, they have that because we live in a global economy where you can import, right? You can import the latest drugs and the latest treatments. You can import them from freer countries where profits are not controlled, where prices are not controlled, like the United States. The United States does not control the prices of its drugs. It does not control profits. People want that for drug companies, but that is not the case right now. And it's not a surprise that the US is the leader in medical innovation, that US is the leader in biopharmaceutical research. So these countries can mask the fact that they're actually very hostile to the development of advancements in medicine. Because it works the other way. These countries, you can have people in these countries working really hard, doing good research, producing good things, and they can't make up all of those costs in their respective countries, but they can export to the United States, for example, where we're willing to pay a lot for all of this stuff. And by the way, the fact that these countries are not controlling the price of their drugs means, of course, that people in the United States, we are way overpaying for our drugs because we're subsidizing the rest of the world. But to the degree these countries are controlling the prices of their drugs, of their treatments, is to the degree they're limiting the ability of producers to innovate, to create the next great drug and treatment. But this is often hidden. Okay, what else do countries with universal health care do to keep their costs low? Because that is the name of the game. Cost control is the name of the game in these countries. You do not have to look very far to find that. Just start reading about it just a little bit. And even in the United States, this is the name of the game, cost control. So they control prices. They limit access to treatment. Not everybody can have everything. If everybody had everything, if we could just give everything to everybody, things would get very expensive very quickly. So government decides. The government decides in all of these countries, one way or the other, what treatments people can get and what they can't get, what they're not allowed to get, because it's too, at the end, expensive. That's rationing, right? The name for that is rationing. People don't like to use the word rationing, but that is what happens. And you'll find more honest proponents of universal health care admitting this, that yes, there's rationing involved. You can't avoid it. The government has to be making these decisions, which means as an individual, you seriously can be out of luck if you're the one who needs a particular medical treatment and the government decides, yeah, that's not going to happen, it's too expensive. So when people think of rationing, when people think about the government limiting access to treatment, we usually think of, or an example that comes up that people are familiar with is the United Kingdom. The United Kingdom is famous for explicitly rationing, and people are more aware of this than they are of it in other countries. And the agency that does this is very inappropriately named. It's called the National Institute for Health and Clinical Excellence, so that, NICE, which is beyond evil. But NICE controls all the medicines, all the tests, all the procedures that it will pay for people in the United Kingdom. And it is not shy at all about what it's doing. They're very, very clear that the determining factor is not the individual's need to cover every base. That is not what they're thinking about, not about you, the individual. But NICE is concerned to provide cost-effective medical care to an entire population. That is their focus. Their focus is cost control. So for example, in the United States, men over a certain age are recommended to get prostate exams. And it makes good sense. Prostate cancer is a very, very common cancer. If you catch it early, it could really help you. It could save your life. It's a good recommendation. In the United Kingdom, NICE says we don't care. We are not paying for prostate exams. We do not think that it is worth it. That even if it helps you catch your cancer a little bit earlier, we don't think that the benefit of that is worth the cost, that it will cost the NHS to provide this. And they have very complicated formulas that they use to try to seem scientific about this. Quality of life, quality-adjusted life years. They judge everything, the cost and how much it's going to improve your life, and they compare it to giving a treatment to somebody else, and what is the quality-adjusted life there, and they try to be scientific about it, but all they're really doing is just deciding whether you're worth it, whether it's worth it to give you a certain treatment that you actually need. So they're very clear. We're not going to pay for things that in other countries people do recognize, as individuals, you might want to get tested for something and catch a cancer early. And if you do get prostate cancer, and there's thousands of examples of this. You get diagnosed with something, and there's more advanced treatments available. There's new treatments available for prostate cancer. There's new treatments available, and NICE will say, no, this will only extend your life by a few months. We don't think it's worth it. It's more worth it to replace somebody else's hip. That will give them more, we think that that'll be worth more than giving you a few months of life. And they're very open about this. But what I think we need to be aware of is that rationing occurs usually not as obviously as it does through the NHS. And I think that's a big part of what people don't understand about countries with universal health care. Rationing does not have to be that obvious. And it's usually not that obvious. And countries have learned, particularly from the United Kingdom, that if we make things that obvious, there could be problems. So this is a description I found of France, the #1 healthcare system in the world, supposed to be. This is a description I found by somebody who, is a proponent of the French medical system and is a proponent of universal healthcare and wants the United States to go down that path as well. And this gentleman said, France is really a model. It's really a model for limiting perceptions of healthcare rationing and restrictions on patient choice. So I underlined perceptions for you, because that's what I'm really trying to get across. That they're a model for hiding the fact that they're doing major rationing. And this is one explanation, or one part of why, it makes sense that they're considered the #1 healthcare system in the world, because they're apparently providing healthcare to everybody and nobody knows there's any rationing. And it's not just France. This is true everywhere. Medicare, which is universal healthcare, socialized medicine in the United States, same thing. You get these surveys, you do these surveys, and people are like, no, there's no rationing. I'm not aware of anything. And so the people who are doing this have gotten very adept at it and very good at hiding it because it's unpopular. They have to do it because these systems are in the red. They have to ration. People don't like knowing about it. They'll get really mad. They'll get up in arms. You cut something in Medicare, people march to the streets. So they have to do it very, very subtly. But that doesn't mean it's not happening. It just means that people aren't aware of it. So how do you limit perception of rationing? How do you do that? How does that usually happen? So it's usually not the case, right, that the government is covering some service and then it decides, yeah, we're not going to cover that anymore. That's a little too obvious for people. People can see, whoa, whoa, whoa. Like, that's like hitting them over the head. So what usually happens is that it happens definitely incrementally. It definitely happens incrementally. It happens slowly, so you don't realize that your range of options is actually getting narrower over time. So new innovation is always threatened. New innovation is always a threat under these systems, right? Because new innovation, if the government's going to cover it, they don't have to cover it because nobody's used to having it yet. So if they just don't cover something, there's less opposition because people can't say, wait, you're not giving me something. They often don't know that the government is making these decisions. And all these countries have these formularies where they decide what kinds of drugs they'll cover and what don't make the cut. And they try to say, well, look, we're being scientific about it, and we think certain things are not effective, and they are effective. But at the end of the day, none of that matters. They're just deciding for you as an individual, we're not going to cover this drug, even though it might actually help you, but we are deciding some things are not worth covering. So new innovation is always a threat here, is threatened. Another way you can subtly ration to limit the perception that you're rationing is that they can nudge people. They can nudge individuals, the patients, to make less expensive choices. They can nudge you, push you in a certain direction so that you cost the government less. But you still think, hey, look, I still have some choices, but the whole framework is the government has set it up and is trying to push you to make certain choices, less expensive choices. So, for example, they do this a lot through imposing financial penalties. They will say, look, we're not going to cover it 100% of one treatment over another. We'll cover it only 80% so that you feel, okay, like you have to pay a lot more for it. They will fiddle with the copays and the deductibles of services, so they raise the copay so people, and the whole idea is that you spend less because to encourage you to not do those, take advantage of those services. Because the government wants to save money, and they don't want to explicitly ration it, so they're nudging you to do that work. So, for example, a really big part of the French healthcare system, really a big benefit that they would tout, is that you can see any doctor. We are not going to stand between you and your free choice of any doctor out there, any specialist. It's not that you need a referral to go get to see a specialist, as sometimes you do, for example, under insurance in the United States. If you have private insurance or you have a network of doctors that are covered. No network. See anybody you want. See them as many times as you want. If you want a second opinion, we'll cover that. If you want a third opinion, we'll cover that too. And that did not last very long. The government decided, okay, that's way too expensive. That's insanity. We got to cut this back. We got to cut this benefit back, but we can't say we're going to cut this benefit back because, hey, we've been touting this is like a great thing about French healthcare. So they introduce all sorts of financial penalties, all sorts of nudging to encourage people to only stay with one doctor. And they're very explicit about this. If you read the literature, this is what they're trying to do. They call it a coordinated care pathway, so they give it a nice name. But it is that if you now switch doctors too much, if you don't register with just one doctor and you don't stick with him, your costs won't be reimbursed as much. You'll have to pay higher co-pays. And the purpose here is to introduce what they call a gatekeeper system, so that you can't see a specialist without first going through your primary care physician. And this was something that they said never would happen, but that is the idea, to introduce this in a way so the patient is not going to a lot of different doctors, that they're not able to do that. In Norway, also, this is openly enforced. You're only allowed to switch your doctor, your GP, twice in a year, and only if there's not already a long waiting list for that doctor. And there's always a waiting list because people wait a lot for care there. And you are not allowed to see any specialist without a referral from a GP. And so they make these doctors really stand in the way of people being able to exercise their freedom. And this brings me to the last way that I think that people limit perception of rationing, which is that they make doctors and healthcare producers do the dirty work for them. Because if the government is telling you you can't have something, people go, whoa, who are you to tell me that? When your doctor tells you you can't have something, people are more likely to trust their doctors, and they think that this is coming from a good place, and it's coming from their clinical judgment of what is best for you. But a lot of times that's not the case. There's a lot of pressure exerted on these doctors to treat people in a certain way and to not treat them in another way. So, for example, in France, this is something fairly recent, the last couple of years has happened. The government has mandated to doctors, you can only prescribe so many drugs. You can only prescribe so many drugs. You cannot be just prescribing as many drugs as you think patients need. There's a mandate on how many drugs you can prescribe. There's a mandate on how many generics versus brand name versus generics you can prescribe, because brand names tend to be more expensive, but it's not, in my experience, it's not the case that they're always working the same, that brand names and generics are exactly the same. Sometimes the brand names, they work a little better sometimes. But there's mandates there that doctors have to then enforce, and you think you're getting a prescription from your doctor and it's coming just from his clinical judgment, but no, it's coming also from this pressure by the government, and there's financial penalties in place for the doctors. If they don't do this, financial penalties in place. Pharmacists, they're getting in trouble if they, as a pharmacy, are dispensing too many brand name drugs. So the government keeps, in countries of universal health care, it keeps costs low by controlling prices, by limiting access to treatment. And the third way it does this is by limiting its investment. Limiting its investment in all sorts of healthcare capital. Limiting its investment in hospital beds. How many hospital beds are we going to have? We're going to limit that, because the more hospital beds we have, we're opening it up for people to come and lie on those beds, and they're going to have costs that we have to then pay. Limit the number of MRI machines and other kinds of scanners, because you have a lot more of them, people will use them more. The mentality really is, if you don't build it, they won't come, which is true, right? It's true in these systems, because if you build something, if you build a new hospital and you tell patients, look, you have a guarantee, you have universal health care, you don't have to pay for it, they will go to that hospital, they will use it. And that's a problem for the government. So it's easy for them to just say, we're not going to build a lot of stuff, and so people, there's only so much spending that will happen in that case, because we just won't have that many people using all of our stuff. The number of doctors is also very strictly controlled in all of these countries. A lot of people don't know this, but in the United States as well, the number of doctors is controlled by the government. It's controlled by Medicare. They limit the number of residency slots available, and that's how they make sure there's only so many doctors, because more doctors means more spending for the government. Now they have to pay for all those patients that this new doctor is going to see. Fewer doctors equals fewer care to pay for. In France, in the United States, they restrict it by residency slots. In France, for example, they restrict it in entry into medical school, second year of medical school. That's where they're controlling it. In Canada, they do this, and they're notorious for doing this in Canada. And one of the big problems this creates, of course, is shortages. Creates shortages because the government is artificially limiting the number of doctors that can train, that can practice. And there are more patients, and you have to wait. It's a major reason people have to wait a lot in countries like Canada and such, because there's only so many producers out there, and that's the way the government is holding down costs. Another way in which they limit investment is they not only just control what they pay doctors, and they not only are controlling the number of doctors, but they're also imposing more globally, they're capping spending, global budgets. So how much is the government going to pay as a whole on healthcare in a given year? And after that point, it has to stop. It has to stop paying. So if you need care beyond that, the government's not supposed to be paying for that. The United Kingdom does this. The VA system in the United States that pays for veterans care does this. France does this. Germany does this. They all have different forms of global budgeting. So for example, in Germany, they have this on doctors. And so what often happens is you can really only see 700 patients, for example, in a quarter. That's how much the government will pay you for, 700 patients. That's it. So if you're the 701st patient, you walk in there, The doctor has to decide, do I treat you or do I not, because I'm not going to get paid for it. And what some doctors do is they go on vacation. They close up shop. They're like, all right, I'm not going to get paid for the rest of the year or the rest of the quarter. I've hit my quota. I'm gone. So those are the three ways, I think the three main ways that the governments in countries with universal health care are keeping their costs low. They have to keep costs low because that is the name of the game. They're deeply in the red. So we're a little short on time. So I wanted to sum this up for you. I wanted to sum this up for you because I've given you an idea of what the government's doing. I wanted to sum this up for you from the other perspective of what patients are experiencing. I've given a little bit of this, but I wanted to take one example of what patients experience in these countries. And that was as a result of all of these controls. So I don't know, I'm not going to go into that right now, but if you want to ask me in the Q&A, we can do that. And it was actually focused on maternity care. Because this is something I think a lot of people go through. It's an experience a lot of people can relate to. What is the experience of maternity care in these countries? And it's really the case, especially particularly in a country like France. I wouldn't want to be in France if I was having a baby. And I can explain more about that in the Q&A. There's a lot of ways in which it's disturbing. So, in countries with universal health care, the trend is we're limiting spending. The government is limiting spending. It is providing less care, because that is the main way you limit spending. You're providing, in a global sense, less care to people. And the other thing you can do to control costs, right, is you can raise taxes. And that's the other thing that is very much the case in all of these countries. So when they say, oh, we're not spending that much on healthcare, yeah, if you go to these countries, you're spending more on healthcare every single day, and your taxes are going up incrementally over time. And that's the case everywhere. There's no way to avoid this, and it's not always obvious, but that is happening. And it happens because people don't like tax increases, so the government has to impose them in subtle ways. One way, for example, a lot of these systems start out by funding only through payroll taxes. That's how Medicare is supposed to be funded in this country. Payroll tax assessed on you, the worker, and the employer pays a portion of that. That's how it is in France, in Germany. But that's never enough. That's not enough taxes. That's not enough taxation. So there's always, you'll see in these countries, they try to broaden the base. So they'll try to tax in every other kind of way. In France, for example, they have introduced a new tax called the general social contribution, whatever that means. And so now we have the payroll taxes that have gone up, plus the general social contribution, plus taxes on anything they can get hands on, right? Anywhere, way they can loot pockets, they do that. Gambling, alcohol, capital, anything they can get their hands on. Drug companies are a favorite. Taxes go up. So the French, for example, are paying a fifth of their income through payroll taxes for their healthcare system. They are paying this general social contribution, which goes up all the time, and they're paying a whole bunch of other taxes, and taxes keep going up. Same thing in Taiwan. Taiwan, 20 years old, universal healthcare, major tax increases already have occurred. And people are 100% certain more taxes are to come. And what's relevant to keep in mind also about these countries when assessing them is that if they don't seem bad now, and I do think that they seem bad now, but if things don't seem bad now, they will get bad very quickly, worse very quickly, because these countries are still in the red. Despite the fact that they are limiting spending as much as they think that they can, despite the fact that they're raising taxes, they're all still running deficits. They're still all running up their credit card bill, in a sense. And that means a lot of pain in the future. And you can just look to Greece to see what pain you can have when your government is in such enormous debt. Not that it has to look exactly the same, but there's a lot of pain in the future for these countries. And you have to see either massive benefit cuts or massive increase in taxation. And that has to come at some point. And they're just putting off the problem, and of course it gets bigger, and we're doing that very much with Medicare in this country. We're just putting off the problem, and it's going to get bigger, because the longer you don't pay your credit card bill, pay that off, the bigger that bill becomes. So this is the reality. This is the reality of what's going on in countries with universal health care. Costs are up, people are spending more, they're getting less care for it, and they're still in the red. This is not the rosy picture that proponents of universal health care draw. This is not this is not what they say, but this is what is going on. And for me, for somebody who lives in the United States, I don't want that. I don't want that. What's going on in other countries, I don't want that here. And the whole push is for the government to cut to spend less on care. Okay, the last portion of this, what I want to talk about, the last point, is I want to then go back to what proponents of universal health care say. And I want to try to make sense of it a little bit. Why do they point to some of the things that they point to say, look, healthcare is really good in these countries. We should be modeling American healthcare based on what these countries are doing. Because it's not that they're liars. There's a sense in which they're not truthful. That's for sure. They're not 100% honest. But it's not the case that they're just lying about it and really they're just trying to put something over on the American people. That's not what's going on. And if you actually start looking into it, you can Google the World Health Organization study that said that France was the #1 healthcare system in the world. You can start Googling that and you can kind of see there's been a lot of discussion about what are the problems in their rankings. There's a lot of invalid things that they're comparing, things that can't really be compared. They're making certain assumptions, causality versus causation. What am I trying to say? That, correlation versus causation. There's a lot of issues there, and you can ask in the Q&A about a little bit of that if you want. But the basic thing that I think is going on is that the standards by which they're coming at their assessments of what is good healthcare are very different from what I think the proper standards should be, and the standards that I use to assess what's going on in these countries. They have different standards. Their standard of the good is different. So for example, when they talk about costs and they talk about spending, it's always assessed at the collective level. It's always assessed at, look, healthcare is cheaper in other countries because we're collectively spending less of our wealth on it. Our collective wealth that we've putting in a pot, we're spending less of it on healthcare than other countries. That's true. They are. The government takes everybody's money and then it spends a smaller portion of it on healthcare. That's true. But who cares? Who cares? What that doesn't get to is what actually matters. Is whether individuals, right? Whether individuals are free to spend their wealth, the wealth that they have earned, the wealth that they have produced, are they able to spend as much as they want on their health care? If they want to spend a lot of their wealth on health care, that's a great thing. What matters is that they're free to do that and that they're doing it. If they decide, yeah, it's not that big of a priority for me, I don't want to spend a lot of my own wealth on health care, what I'm earning, that's fine too. But what's important is that people are free to make these choices about their own lives. And collectively, if it adds up that all of us are collectively, individually choosing to spend a lot more of our wealth on healthcare because we as a nation, health is a bigger priority than it is for some other country, that's a great thing. There's nothing wrong with that. There's no problem with that as long as people are free to make these decisions about their own lives with the resources that they have produced. And under universal health care, you don't have that freedom. It's the government deciding how much of the nation's resources will be spent on you. And you can't see that. You can't see that in this graph, in the way these things are presented. There's no concept of the individual. What is happening to the individual? Is he able to spend what he needs to on his health care? You can't see that. That's not there at all. It's totally shaped by collectivism. But if you don't see individuals, this looks great. The issue of quality. Why is France the #1 healthcare system in the world? What is the World Health Organization thinking? Well, if you actually look at some of the standards that they use, it's very clear what they're thinking. They're coming at good healthcare from a very different perspective. Built into this assessment, and built into this assessment explicitly, are questions and issues surrounding, well, does this country's government guarantee that everybody can get health care regardless of whether they can actually pay for those services? That's built right into the assessment. Well, the United States does not have universal health care. Surprise, surprise, it's number 37. But that doesn't tell you anything. It just tells you that they're motivated by a certain ideology. And that's their assessment, the ideology, the idea, not the reality. Their concept of fairness, and this has a very big weightage in the World Health Organization study, a very big weightage because they weigh these things differently. Fairness. What the heck does fairness mean? It means, are the rich paying the healthcare bills of the poor? If they're not, that's a big problem. It's not fair. And then you get ranked real low. Are the rich and the poor, are they experiencing the same life expectancy? Are they experiencing the same infant mortality? Are they experiencing the same everything? Egalitarianism is all over this. Everything is shaped by collectivism and egalitarianism in these studies. The proper standard, and it's a complicated question, well, how do you, if you had to rank all of these countries, how would you rank them? But I think the general sense should be, the general standard should be, in which country is the best healthcare available? The best. What is the best that money can buy? Because what that means is that something great has been produced, that it exists, that the best drug exists. And I want to be in a country where that exists. I don't need the guarantee that I can get it, but that it exists, because that means that somebody has created it. I want to be in that country, the country where people can create great things. And I want to be in a country where I'm free to pursue those things. That's in my control, not in the control of the government. That should be the proper standard. So in conclusion, let me conclude this up, and we'll have a few minutes for questions. What I'm saying today should not be seen as, oh, Ritu has figured this out. I'd love that you think that I'm so smart, I figured it all out. I didn't. People have been saying this. The proponents of universal health care have been saying this. That you guys are believing in a myth. You guys are believing in a myth. You guys are believing in a utopia. There's no utopia out there. There's a great book on this called The End of an Illusion. It was written in 1984. It was written by a bunch of the proponents and the leaders of universal healthcare system, France, Canada, United Kingdom. And they called the book The End of an Illusion. And they're saying, end this illusion. The notion that the welfare state can provide an abundance of health services for all of its citizens, it's an illusion, people. It's not possible. They're very explicit that the government is going to have to make these decisions, hard decisions, life and death decisions. It's not just going to be, you always hear, we'll cut the waste, we'll cut the fraud, we'll cut the abuse in the system. No. When the fat has been cut away, they said, it'll be clear that the best way to save is not to spend. Just don't spend money, and then you have your costs under control. And that means the government's going to have to decide. Quote, should a child with a rare blood disease who requires transfusions costing $2,200, which is, well, it was a lot back then in the 1984. That's how much it requires. Should he be kept alive? Should pacemakers be widely available to the elderly? Should kidney dialysis be available to everyone who needs it? These are questions they're saying the government's going to have to start making, and we should wake up to that fact. Should everybody get access to the latest technology? Doctors, they say, the concept of clinical freedom is unlikely to survive. Can you change the slide? Yeah. Is unlikely to survive. Physicians are increasingly aware, they say, that they must work in teams, accountable not only to their professional values and to individual patients, but to a new public morality and new social and economic constraints. The whole idea that a doctor is treating you, the individual, it's an illusion. They're admitting this more than 30 years ago, and it's not admitted, they're writing about this. It's a book, it's available, you can get it on Amazon. I mean, it's not a secret. So the idea today, the notion today, that universal health care is this utopia where things are cheap and quality is great and everybody gets it, it is just made up. It is absolutely made up. And the United States, if we want to prevent the United States from becoming like this, we're already down the road significantly. But if we want to still maintain some goodness and start moving in the right direction, we have to fight this. We have to fight universal health care in the United States. We have to fight the people who want it. It literally is an issue of life and death. Thank you.